Today's topic will be sexually transmitted infections. They are a group of communicable diseases, as the name suggests, which are transmitted by sexual contact. Among them, there are some agents causing local manifestations called genital tract infections, and among them, the lesions common to both the sexes are such as genital ulcers, urethritis, and anorectal lesions. And the female genital tract lesions are vulvovaginitis, cervicitis, and others, whereas the male genital tract infections are prostatitis, epididymitis, and orchitis. The agents causing systemic manifestations and others are the agents causing systemic manifestations without producing local manifestations like the HIV, hepatitis B and C. Now, let us look at the agents causing local manifestations of the genital tract infections. Syphilis is caused by Treponema pallidum. Chancroid is caused by Haemophilus ducreyi. Genital herpes caused by herpes simplex virus. Lymphogranuloma Venereum caused by the chlamydia trachomatis. Donovanosis caused by Klebsiella granulomatis. Urethritis, among them is the most common is gonococcal urethritis, which is caused by Neisseria Gonorrhoeae, whereas the non-gonococcal urethritis is caused by chlamydia trachomatis, mycoplasmas, herpes simplex, candida and parasite called the trichomonas vaginalis. তাহলে আবার দেখি genital sexually transmitted infections দুই ধরনের হয় তন্নিষ্ঠা, একটা হচ্ছে সিস্টেমিক আর একটা হচ্ছে লোকাল। লোকালস গুলো কি কি, যেমন Genital Ulcerative Diseases, Syphilis, Chancroid, Herpes, Donovanosis, Gonococcal urethritis এইগুলো। আর সিস্টেমিক গুলো হলো কি গোটা সিস্টেমকে ইনভলভ করে, যেমন HIV, hepatitis B আর C. And in both the sexes, genital tuberculosis caused by Mycobacterium tuberculosis, anorectal lesions caused by HSV, gonococcus, chlamydia trachomatis, and another is very important, anogenital warts caused by the human papilloma virus. And one trivia question for you is this is also a vaccine preventable disease. As you know, the cervical cancer vaccines are going on by the government. These against the human papilloma virus. So these are one of our vaccine preventable diseases. Vaivate kintu jigesh kore, name some vaccine preventable cancer. Answer will be vulvovaginitis in females. Now coming on to all these sex specific lesions. Vulvovaginitis is caused by bacterial vaginosis, trichomoniasis and candidiasis. Mucopurulent cervicitis caused by the gonococcus and chlamydia trachomatis. And the pelvic inflammatory disease which presents as endometritis, salpingitis, euphoritis, tubo-ovarian abscess, and they can extend to the peritoneum leading to peritonitis, pelvic abscess and perihepatitis, inflammation around the hepatic systems of the liver. Infection, any infection after gynecological surgery. And in males, the sex-specific lesions are prostatitis, epididymitis, and once again coming on to the systemic lesions, HIV, hepatitis B or C. Now coming on to the genital ulcerative disease. They comprise of the 5 important sexually transmitted infections. এগুলো কিন্তু তোদের ভীষণ ভালোভাবে জানতে হবে। কি কি সেগুলো? স্নেহা তো syphilis, chancroid, genital herpes, lymphogranuloma venereum and donovanosis. Chancroid কে করে? You have please learn this chart by heart. This is in every book. Learn this chart by heart, okay? এইটা পড়লেই তোদের পুরো চ্যাপ্টারটা মুখস্থ হয়ে যাবে। এই একটা পাতার মধ্যেই পুরো চ্যাপ্টারটা রয়েছে। Comparative manifestations of the genital ulcerative diseases. Syphilis has the longest incubation period of 9 to 90 days. The genital ulcer here is painless, single and indurated. Remember, syphilis produces painless lesions at first, genital ulcer, indurated, single lesions. Lymphadenopathy হচ্ছে painless, non-indurated form and bilateral. Syphilis এর ট্রিটমেন্ট হচ্ছে পেনিসিলিন। সিফিলিস আমরা কিভাবে বুঝবো? VDRL টেস্ট করে। Genital herpes, incubation period of 2 to 7 days. Herpes এমনিতেও যেরকম হয়, multiple blisters, bilateral, painful, vesicular ulcers. Genital ক্ষেত্রেও সেরকমই হবে। Lymphadenopathy will be painful, often bilateral. Drug of choice হচ্ছে acyclovir, এমনি normal antiviral acyclovir যেটা আমরা খাই. Chancroid, incubation period of 1 to 14 days. The genital ulcer here is painful, soft, multiple, purulent and bleeds easily on touch. The lymphadenopathy is painful, marked swelling leads to bubo formation which is unilateral. Drug of choice হচ্ছে single dose azithromycin. Lymphogranuloma venereum, এটা হচ্ছে আবার painless, ঠিক syphilisের মতো painless and soft unilateral lymphadenopathy. Drug of choice is doxycycline. In Donovanosis, there is 1 to 4 weeks. There are painless multiple beefy red ulcer which bleeds easily. তাহলে সিফিলিসের সাথে তফাৎটা কি, এটাও পেইনলেস ছিল কিন্তু এটা beefy red ulcer which bleeds easily. And drug of choice is azithromycin for 7 days. Now coming on to the detailed discussions about the individual lesions. So syphilis is caused by Treponema pallidum, which is causative of an ancient sexually transmitted disease. The name pallidum refers to its pale staining property. Pale stain নেয় বলে একে বলা হয়. They are thin, flexible, elongated, spirally coiled helical bacilli. Includes Treponema, Borrelia and Leptospirea. The treponemes are slender spirochetes with fine spirals having pointed ends, tripus meaning turn and nema meaning thread. Most of them are commensals in the mouth and genitalia. Only a few species are pathogenic to men. They are divided into 3 groups. Sexually transmitted কি Treponema pallidum যেটা syphilis করে, আর non-venereal হলো Pallidum, endemicum আর Caratium. Mode of transmission venereal and non-venereal. Venereal তো sexually, non-venereal হচ্ছে direct contact, blood transfusion and transplacental. That is why during blood transfusion we always do a test for syphilis also. VDRL test করা হয়. কেমন? Spreads কিভাবে করছে? The Treponema pallidum spreads through the penetrates through the mucosa or abraded skin. Then they enter the lymphatics and blood. They are transmitted systemic and causing the primary lesion. Incubation period is variable and inversely proportional to the number of organisms inoculated. Approximately 30% of the people who have sexual exposure with an infected partner develop syphilis. ঠিক আছে? Clinically, patients suffering from syphilis pass through 4 stages if left untreated: primary, secondary, latent and tertiary or late stages. If transmitted vertically, the newborn babies develop a congenital form of syphilis. সেই জন্য প্রেগনেন্ট মাদারদেরও কিন্তু প্রতিটা ফার্স্ট ট্রাইমেস্টার এবং থার্ড ট্রাইমেস্টারে দুবার করে ভিডিআরএল টেস্ট করা হয়. কেন করা হয় সন্নিষ্ঠা? টু সি এই নিউবর্ন বেবিতে যাতে ওদের যাতে congenital syphilis যাতে না হয়. Now what are the lesions? The primary or the hard chancre. We have already discussed that lesion will be painless. They are single painless papule, ulcerated and indurated. This is covered by a thick exudate which is rich in spirochetes. What are the common sites of the primary lesion? Penis, cervix or labia, and heals within 4 to 6 weeks. There is regional or inguinal lymphadenopathy which is painless, firm, non-suppurative and often bilateral, may persist for months. If acquired by non-venereal mode, direct contact extragenitally হয় on the fingers, blood transfusion এও primary chancre হয় না. এই প্রথমে যেটা primary lesion আমরা দেখলাম chancre, সেটা শুধুমাত্র वर्षा जो हमने lesions देखा primary lesions, वो हमें कहाँ पे मिलते हैं? Only if it is sexually transmitted. If it is non-sexually transmitted, there will direct contact. There will be at the point of contact on the fingers if you mistakenly touch a patient, or if it can come through blood transfusion, there the primary chancre will be absent. Secondary syphilis, primary পরে the patient develops into secondary syphilis if it is left untreated, develops 6 to 12 weeks after healing of a primary lesion. The skin and mucous membranes are commonly affected. There are these skin rashes. Condyloma lata, the mucocutaneous papules coalesce to form a large pink to grey lesion in the warm, moist intertrigus areas such as the perianal region, vulva and the scrotum. And in the mucosal patches, in the mucosa there is superficial mucosal erosions. Okay. So, what is condyloma lata? This comes as a viva. They are mucocutaneous papules which coalesce एक साथ जुड़ जाता है वर्षा to form large pink to grey lesions in the warm and moist intertrigonous areas like the perianal region, vulva and the scrotum. Latent syphilis, in absence of, as the name suggests, latent, there will not be any clinical manifestations, it will be only serologically positive. Patients will be infectious, transmitting the infection, and they can persist into a lifelong infection, development of a late syphilis, or spontaneously get cured. In late or tertiary syphilis, there can be gamma, which locally destructive granulomatous lesions found on the bone and the skin. Neurosyphilis, the syphilis can spread to the central nervous system, leading to chronic meningitis, vasculitis, general paresis of the insane and tabes dorsalis. And when it affects the cardiovascular system, there is aneurysm of the ascending aorta and aortic regurgitation. Congenital syphilis, if the mother is syphilis positive, VDRL positive, mother-to-fetus transmission can lead to development of various congenital manifestations. Let us look at them. Congenital manifestations like Seberstein's, Mulberry molars, etc. একটা ট্রায়াড ছিল মালবেরি মোলার্স সেবারশিন আর একটা আমার মনে পড়ছে না একটু দেখে নিস ঠিক আছে কনজেনিটাল সিফিলিসে Now coming on to the most important part in a microbiology, the laboratory diagnosis of syphilis. We will diagnose is done by dark ground microscopy. They are not properly stained, so we do not do gram staining for them. They are seen by dark ground microscopy or direct immunofluorescence staining for Treponema pallidum. Silver impregnation method like Levati stain for tissue section and Fontana stain is done for smears. In a dark ground microscopy, the whole background will be dark and Treponema pallidum will be appearing as a helical coiled bacilli and direct fluorescent antibody staining like this. These are direct fluorescence. Okay. It cannot be cultivated. The standard test for syphilis or reagent antibodies are detected by using the cardiolipin antigen. The specific treponemal tests are antibodies are detected by using Treponema pallidum antigens. The non-treponemal tests, reagent antibodies are detected by using the cardiolipin antigen. Of this, the most commonly used test is the VDRL. সব সময়তে হয় যে কোনো এটাতে sexually transmitted infection এ VDRL, RPR, trust, the toluidine red unheated serum test and USR or the unheated serum reagent test. Okay. And the specific treponemal tests are where the specific antibodies of the treponema are detected by using the Treponema pallidum antigens like the Treponema pallidum immobilization test, FTA-ABS like the fluorescent treponemal antibody absorption test, Treponema pallidum agglutination test, TPHA or the Treponema pallidum hemagglutination test, TPPA, Treponema pallidum particle agglutination test. The CDC recommends using a testing algorithm comprising of a non-treponemal test like a screening test which is followed by a treponemal test for confirmation for serodiagnosis of syphilis. In an area of high prevalence, reverse algorithm where a treponemal test is performed first followed by the non-treponemal test. Okay. And as we are saying, every pregnant woman undergoes a non-treponemal screening test at her first antenatal visit, and if there is high risk of exposure, again retested at the third trimester and at the delivery. যে কোনো প্রেগনেন্ট ওমেনে একবার ফার্স্ট ট্রাইমেস্টারে একবার থার্ড ট্রাইমেস্টারে তার সিফিলিসের জন্য VDRL মানে নন ট্রিপোনেমাল টেস্ট করা হয়। And both the syphilis and HIV affect each other's pathogenesis because the genital syphilis facilitates the transmission of HIV through the abraded mucosa. There is 2 to 5-fold increased risk. Patients with HIV, if develop syphilis later, they go to rapidly progress to the later stages of syphilis, and also there is নিউরোলজিক্যাল ইনভলভমেন্ট। টিবি আর এইচআইভি যেমন একসাথে গোজ হ্যান্ড ইন হ্যান্ড অলমোস্ট, ঠিক তেমনই সিফিলিসের সাথেও এইচআইভি আর সিফিলিস অ্যাফেক্টস ইচ আদার্স প্যাথোজেনেসিস। অ্যাব্রেডেড মিউকোসা থ্রু দিয়ে ট্রান্সমিশন অফ এইচআইভি আরও বেশি হয়ে যায়, 2 থেকে 5 গুণ বেশি হয়ে যায়। এইচআইভি পেশেন্টের যদি সিফিলিস হয় তাহলে তারা পরবর্তী স্টেজগুলোতে খুব তাড়াতাড়ি চলে যায়, অ্যান্ড দের ইজ অলসো নিউরোলজিক্যাল ইনভলভমেন্ট। হোয়াট আর দ্য প্রবলেমস in diagnosis of syphilis in HIV infected people? Confusing the clinical picture due to the lack of serological response, unusually high titers in non-treponemal test, failure of the non-treponemal test titer to decline even after treatment, and disappearance of the treponemal test reactivity over time. Immunosuppression হয়ে যাচ্ছে, সেই জন্য কি হচ্ছে, সেরোলজিক্যাল কোনো রেসপন্স নেই। নন ট্রিপোনেমাল টেস্টগুলোতে আনইউজুয়ালি হাই টাইটার্স পাবি, আর ট্রিটমেন্টের পরেও ওগুলো ডিক্লাইন করতে চায় না, আর রিঅ্যাক্টিভিটি অ্যান্টিবডি থাকে না, সেজন্য টেস্ট রিঅ্যাক্টিভিটি ডিসঅ্যাপিয়ার করে যায়। ঠিক আছে। Drug of choice penicillin for all the stages of syphilis. In primary, secondary, or even early latent syphilis, a single dose of penicillin G is given. Late latent but severe but benign tertiary stage, penicillin G is given single dose weekly for 3 weeks. In neurosyphilis, aqueous, crystalline or procaine penicillin G is given for 10 to 14 days. Alternative drug কিসে? tetracycline। আর নিউরোসিফিলিস বা প্রেগন্যান্সি অ্যাসোসিয়েটেড উইথ এইচআইভি থাকলে ডিসেনসিটাইজেশন পেনিসিলিন করে তারপর দেওয়া হবে। Evaluation after treatment, at least 4-fold decline in the titer by 3rd or 4th month, and 8-fold decline in the titer by 6 to 8 months. দেখা হয়। Now coming on to the chancroid or the Haemophilus ducreyi. These are chancroid or the soft chancre, sexually transmitted infection. They have painful genital ulceration which bleeds easily. There is no inflammation and there is enlarged tender inguinal lymph nodes or bubo. The common cause of genital ulcer in the developing countries, transmission is predominantly heterosexual. Male to female ratio is 3:1 to 25:1. Chancroid and HIV. Chancroid increases both efficiency of transmission and the degree of susceptibility to HIV infection. What are the specimen? Exuded or swabbed from the edge of the ulcer and lymph node aspirate. Direct microscopy te ki pabo? Pleomorphic gram-negative coccobacilli which occurs in groups or in parallel chains, and there is bipolar staining. কিরকম ভাবে দেখতে পাবো? School of fish or railroad track appearance. Haemophilus, as the name suggests, requires factor X and but not factor V. Rabbit blood agar বা chocolate agar enriched with 1% isophytal X and made selective by adding vancomycin. Optimum conditions are 10% CO2, high humidity and incubation temperature of 35 degrees Celsius for 2 to 8 days. They are biochemically inert. So as the name suggests, Haemophilus তার মানে ব্লাড কে পছন্দ, তার মানে শুধুমাত্র চকলেট আগারটাকে এনরিচ করে তারপরে হবে, এমনি নর্মাল ব্লাড আগারে কিন্তু না, চকলেট আগারে হয়। কেমন? Diagnosis is done by multiplex PCR assay and specific antiserum. Drug of choice, azithromycin 1 gram oral single dose. Alternative drugs are ceftriaxone, ciprofloxacin or erythromycin. And here also treatment of all the sexual partners is essential. Now coming on to herpes genitalis. This is caused by HSV 1 and 2. They produce widespread disease, cutaneous, mucocutaneous and also systemic. Genital ulcers gulo multiple, painful, bilateral, tiny vesicular ulcer. Multiple মানে অনেকগুলো, পেইনফুল, অবভিয়াসলি জেনিটাল হার্পিস যেমন পেইনফুল হয়, এবং বাইল্যাটারাল বোথ সাইডে হবে টাইনি ভেসিকুলার আলসার, জল জল ফোস্কার মতো। ইঙ্গুইনাল লিম্ফ্যাডোপ্যাথি, দিস ইজ enlarged, tender and firm and bilateral lymphadenopathy. They have recurrent episodes, milder and recover faster than the primary genital herpes. And the associated symptoms are fever, headache, malaise, myalgia, itching, dysuria, vaginal and urethral discharge. Other genital infections are urethritis, vulvovaginitis, cervicitis, endometritis and salpingitis, HSV proctitis and perianal infections following rectal intercourse. Laboratory কিভাবে diagnosis করব? Staining of the scrapings from the base of the lesions are stained with Giemsa stain. or Papanicola stain, giant cells or internuclear inclusions দেখতে পাই আমরা, অথবা viral antigen by direct immunofluorescence test or viral DNA is detected by PCR in the scrapings from the lesions. Multiplex platform of PCR, real time PCR এরকম ভাবে দেখা হয়। Drug of choice হচ্ছে acyclovir or valacyclovir given for 7 to 14 days. IV acyclovir is given in severe disease or associated neurological complications. In recurrent genital herpes, a short course of 1 to 3 day regimens is given. Now we will go to Lymphogranuloma Venereum. You are reading one system. Go for system wise, okay? Like you are reading a CVS. Now coming on to the next topic is the Lymphogranuloma Venereum or LGV. This is an invasive systemic sexually transmitted infections caused by Chlamydia trachomatis, serovirus L1, L2 and L3. The clinical course passes in 3 stages. In the first stage, there is painless papule or ulcer or vesicle on the penis or the vulva. In second stage, there is bubo, which are enlarged, tender and soft inguinal lymph nodes. In fistula, the buboes break down, causing discharge, spreads and leading on to chronic fistula, which have systemic symptoms like fever, headache and myalgia. In third stage, there is rectal stricture or rectovaginal and rectal fistula, leading to osteomany, edematous granulomatous hypertrophy of the vulva, scrotum or the penis, elephantiasis of the vulva or the scrotum. Elephantiasis was also seen in খুব কমনলি আমরা পড়েছি এবং অনেকবার পড়েছি filariasis, swelling of the lower limbs. Diagnosis, how to diagnose this? This diagnosis is based on serology, where the biopsy is absolutely contraindicated. নাহলে sinus tract form হয়ে যেতে পারে. Nucleic acid amplification test, Chlamydia trachomatis will be positive, and antibody detection test is done by ELISA or microimmunofluorescence. Direct detection of the inclusion bodies by direct immunofluorescence. Treatment, longer treatment course necessary. Drug of choice হচ্ছে doxycycline for 21 days, also azithromycin weekly once for 3 weeks. Donovanosis, also called the granuloma inguinale. This is caused by Klebsiella granulomatis, which was previously known as Calamibacterium granulomatis. This was first described in Kolkata in 1882. Then Charles Donovan demonstrated the Donovan bodies in the genital lesion in Chennai in 1905. Can you name the person who got Nobel, the first Nobel from India? The person who got the first Nobel Prize from India. না, সিভি রমন তো অনেক 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 পরে। না, it's Ronald Ross, the first person to get from India. The first Indian was Rabindranath Tagore, but the first person from India was Ronald Ross. ওই পিজির বিল্ডিং এর সামনে রোনাল্ড রস বিল্ডিং, ওইখানেই তো ইয়ে করে মস্কোভিটের এটা পেয়ে ওইখান থেকেই পেয়েছিল 1905-এ। Donovanosis is prevalent in India, Brazil, Papua New Guinea and parts of South Africa. Poor hygiene, lower socioeconomic status and multiple sex partners are the risk factors. Incubation period is 1 to 4 days, 1 to 4 weeks. The lesion starts as a painless papule, beefy red ulcer that bleeds readily when touched. The sites are 90% cases are the sites of the genitals, prepuce, frenulum and glans in men and labia minora in women. Pseudobulbos are found in the inguinal region due to subcutaneous abscess. Specimen collection, swab, a piece of granulation tissue. Direct microscopy is done from rapid GIMSA right stain. Donovan bodies, large cyst-like macrophages filled with deeply stained capsulated bacilli. We have a safety pin or a bipolar appearance. They are non-motile, capsulated and gram-negative organisms. Culture কিভাবে করব? Egg yolk medium and on Hep2 cell lines. Molecular method PCR is done to differentiate Klebsiella granulomatis from the other Klebsiella species by detection of the POHE gene. Drug of choice হচ্ছে azithromycin 1 gram orally per week or 500 milligram daily for at least 3 weeks until all the lesions have completely healed. Alternative drug of choice হচ্ছে doxycycline বা cotrimoxazole for 14 days. Urethritis, gonococcal urethritis. Neisseria gonorrhoeae, it's a non-capsulated gram-negative kidney-shaped diplococci. Virulence factors are the pili or fimbri. They adhere to the host cells and prevent phagocytosis. Outer membrane proteins like porine, opacity-associated protein, which adheres to the neutrophils and other gonococci. The transferrin binding and lactoferrin binding proteins, Ig1A proteins, and the lipo-oligosaccharide. The gonorrhea produces various infections in males and females. In males, there are acute urethritis, which is the most common, purulent urethral discharge. Incubation period is 2 to 7 days, and it can lead to epididymitis, prostatitis, balanitis, and water can perineum. যে কোনো সময়তে এরকম এই সমস্ত পেশেন্টরা পিউরুলেন্ট ইউরোথ্রাল ডিসচার্জ নিয়ে আসে, ওটার গ্রাম স্টেন করে আমরা কিডনি শেপে ইন্ট্রাসেলুলার গ্রাম নেগেটিভ ডিপ্লোকক্কাই দেখতে পাই। মাথায় রাখবি intracellular kidney shaped diplococci. In females, infection is less severe. They have more asymptomatic carrier than the males. Mucopurulent cervicitis, most common presentation. Vulvovaginitis in prepubertal girls and postmenopausal women. Vagina mucosa is thinned out and due to higher pH. They can spread to the Bartholin's gland and salpingitis and pelvic inflammatory disease, and also cause Fitzhugh-Curtis syndrome, which is a rare peritonitis and perihepatic inflammation. And in both the sexes, it can cause anorectal, pharyngeal, and ocular gonorrhea. In pregnant women, it can cause prolonged rupture of the membranes, premature delivery, chorioamnionitis, and sepsis in the infant. In neonates, which is coming out through the birth tract, it can cause ophthalmia neonatorum, purulent eye discharge within 2 to 5 days of birth. Disseminated gonococcal infection, it is rarely and HIV infected persons non-ulcerative gonorrhea হয়। Transmission. Host হচ্ছে exclusively human disease. Source is usually an asymptomatic female carriers or less often a patient. Transmitted by sexual contact, venereal and mother to baby during the birth. Diagnosis is done by urethral swab in men and cervical swab in women, in dacron or rayon swabs. In chronic urethritis, secretion after prostatic massage or morning drop of secretions. Transport medium কিভাবে? Steward transport medium অথবা Ames transport medium. গ্রাম নেগেটিভ ইন্ট্রাসেলুলার কিডনি শেপের ডিপ্লোকক্কাই। ঠিক আছে, এটা কিন্তু আমাদের অস্মিতে থাকে। ওকে, endocervical swabs contain normal flora, so selective media is preferred, which will inhibit the commensal Neisseria. Thier-Martin media like chocolate agar with antibiotics is used. Gonococci are catalase and oxidase positive, ferments glucose but not maltose and sucrose. And nucleic acid amplification test or PCR can be done. Drug of choice for uncomplicated infection হচ্ছে ceftriaxone 250 mg intramuscular single dose বা cefixime 400 mg orally single dose. Coexisting chlamydial infection থাকলে azithromycin বা doxycycline add করা যায়। কোনো ভ্যাকসিনেশন নেই, early detection of cases and treatment of both the partner, tracing of the contacts is done. Non-Gonococcal urethritis আর যাবো, জাস্ট একবার নামগুলো পড়ে দিচ্ছি। Chronic urethritis where gonococci cannot be demonstrated, bacteria like Chlamydia trachomatis, Mycoplasma, viruses like Herpes simplex virus, Candida albicans, parasite like Trichomonas vaginalis. Okay. Now this comes very often, the difference between gonococcal and non-gonococcal urethritis. Gonococcal urethritis onset is earlier, 48 hours. Non-gonococcal urethritis has a longer onset of more than 1 week. Urethral discharge, purulent, mucous to mucopurulent, complication, disseminated gonococcal infection. Diagnosis is done by gram stain, culture is done on Thier-Martin medium. Reuters syndrome for chlamydia, কালচার ইজ ডান অন ম্যাকয় হেলা সেল লাইন্স, ট্রাইকোমোনাস হচ্ছে ট্রফোজয়েটে দেখা হয়, ক্যান্ডিডা বার্ডিং ইস্ট সেলস, এইচএসভি বা ক্লামাইডিয়ার জন্য পিসিআর, গনোকক্কাসের জন্য সেফট্রাক্সন, ক্লামাইডিয়া ডক্সিসাইক্লিন, ট্রাইকোমোনাস মেট্রোনিজল, ক্যান্ডিডা হচ্ছে কোট্রিমাজল। Chlamydia trachomatis, obligate intracellular bacteria, they can cause trachoma, lymphogranuloma venereum, conjunctivitis, pneumonia and cytotoxis. So we are calling it quits here, okay?